Hi there, if you are new to my channel, welcome. My name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. And so before I begin, I have a freebie for those parents that are in NICU right now, and it's a cheat sheet that contains all the common medical terms that are used in the NICU. So if you are looking for that freebie and you think that would help you, make sure you check it down in the description box and grab it. This month, I plan to focus on bringing you stories of prematurity and the NICU. And I know the NICU is not only full of premature babies, but prematurity is the #1 cause of babies going to the NICU. And unless you had family or friends that had a premature baby, most people have no idea what it's like. So this month, I want to focus on bringing you stories of hope, stories of bravery, stories of love. So I'm so excited to share these stories with you because these stories can help so many parents out there that are struggling through NICU. When you see somebody else that went through NICU and that is on the other side, it really gives you hope that one day you will get there. So that's why I really wanted to focus on stories this month. So if you're excited, just like I am, let's just get into it. So the first story is from Alicia. My name is Alicia. My son Lincoln was a 33-weeker, now almost 3 years old. I lost a 21-weeker in February, and I'm currently 25 weeks pregnant, and she's high risk. So for my first pregnancy, which was her 33-weeker, I had a fairly normal and easy pregnancy. I started dilating slowly around 29 weeks. I received both shots of steroid for his lungs around 32 weeks. So basically, when I'm reading these stories and there's a point that I want to explain or a procedure or a term that I want to explain, I'm going to stop and explain it just so you know how this video is going to work. So Alicia mentioned that she was dilating around 29 weeks. That means her cervix started opening up prematurely on its own. And so that's a huge risk of having a premature baby because the baby's coming out earlier than expected. So whenever a mom is at risk of having a preterm labor, we always try to give 2 shots of the steroid, which Alicia got. The thing is, the 2 shots of steroid have to be 24 hours apart. So we try to get moms to stay pregnant for that long. Hopefully they can get the 2 shots of steroid because those 2 shots of steroids really help the baby's lungs in the NICU. Those babies tend to do better when it comes to their lungs. 2 shots of the steroids are really important to get if you can. So my son Lincoln was in the NICU for 13 days. He was born at 33 weeks. He was mainly a feeder grower. And I have a photo right here that I will insert of Lincoln. And such a cute photo. Beautiful baby with his light hair. And he has a feeding tube. So he was mainly a feeder grower. And he needed to learn to suckle and he had some jaundice. So this means that he was learning how to just feed and grow. He was breathing on his own. He was growing well. So the biggest thing that was keeping him in the NICU is to learn how to feed by mouth and to eventually go home. So we call these babies feeder growers because they are big babies that are just learning how to feed and breathing on their own. So he did have some jaundice, but he did not need some light therapy. Jaundice is very common in the NICU, even for the really small babies to the big babies. And now he's almost 3 and he has passed every milestone. Oh, that's so nice to see and hear. And so I'm gonna insert a photo of Lincoln right here. And oh, so cute. My son actually has very similar pajamas, but here's Lincoln smiling with his cute eyes and his smile. Oh, so cute. I'm so glad Lincoln did well. Your advice on prematurity and NICU. So prematurity is terrifying. You never know how many things need to go perfect to have a full-term baby and a healthy baby. But thanks to the NICU teams, our babies have very good chances and get to come home a lot of the times. So her second pregnancy. So her second pregnancy was a loss. For my loss, I started bleeding on and off from 13 weeks and 4 days. I was told everything was fine. I ended up having a placental abruption at 21 weeks and 1 day, and the NICU could not intervene until 22 weeks. So placental abruption is when the placenta completely comes off the uterine wall, and that is an emergency. because that baby doesn't get oxygen, doesn't get the nutrition it needs, and will need to come out as soon as possible. But this baby was only 21 weeks, so the NICU did not intervene. So her third pregnancy, so she's currently 25 and 4 days with her hopefully rainbow baby, and she's high risk, of course, because once you have a premature baby, you're automatically high risk with all your other pregnancies. And my first was a preemie, so my second, I was automatically high risk. So they put you high risk just because the condition that made you go into preterm labor and have a premature baby might return. So they automatically make all moms high risk to monitor you closely. So that is all for Alicia's story. So I just want to say thank you so much for sharing your story. My prayers goes out to you right now in your pregnancy. I know exactly how you're feeling because you are probably so nervous and so anxious with every ultrasound and every blood test, thinking something will go wrong. So you literally expect the worst once you have a premature baby. So my prayers goes out to you, and I hope everything goes well, and hopefully you can go full term or close to full term. And she also made a good point in mentioning that how prematurity is terrifying, and you don't realize what a blessing it is to have a full-term baby until you don't, basically. And so this is a really good point that I myself even reflected on, and that everybody that's pregnant expects to go full-term. You, of course, right? Because that's basically what everybody tells you, that you get pregnant, you go for the full 9 months, you have labor, you have this baby, you take this baby home. Like, this is basically the story that you've been told since you were young. But that is not the case for everybody. A lot of moms go through having a premature baby. So I just want moms to understand that the feeling that you're going through, like, why did it happen to me, is all normal. And you right now having a premature baby and being in the NICU was written and best for you because you can handle it. Not your sisters, not your sister-in-laws. You are meant to have this baby prematurely and go through everything that you're going through because you do have the tools to get through. And I know it's so hard to see that right now, like when you're in NICU, but after NICU, you start to realize that this baby is meant for you. Basically, I just wanted to say that we are made for this and you will get through it. Many, many moms, that the stories that I'll be telling are on the other side of the NICU. So just hold on and have hope. So here is the second NICU story. Hi, my name is Erica. How was your pregnancy? Hi, yes, my pregnancy was very challenging. At 8 weeks and 4 days, I was having a threat miscarriage and I was put on bed rest. Oh, that's always so scary. At 13 weeks and 5 days, I got told there was no heartbeat and went back a couple of hours later and she was still hiding there. 14 weeks and 2 days, we found out we were having a girl. Doctors told me danger was gone and nothing to worry about. At 19 weeks and 2 days, wow. So from the beginning, Erica has been having complications in her pregnancy. So at 19 weeks and 2 days, I got told my daughter had spina bifida and also started losing my mucus plug. So basically what a mucus plug is it's a collection of mucus that sits right in the cervical canal. And it just sits there and it creates like a plug. So no bacteria and nothing can get into your uterus and into your baby. So it's just like a plug, so nothing can get in. So once you lose the mucus plug, and that usually happens in the later stage of pregnancy, that alerts the body and the cervix to start labor. Erica lost her mucus plug at 19 weeks. So very, very early to lose the mucus plug. At 22 weeks, I got told I had a short cervix and I started progesterone. I asked if I can get the cerclage, but they told me it was too late, which is true. At 23 weeks, my cervix was 0.4 and they couldn't do much and just wait for a miracle. At 24 weeks, with 2 days, my water broke. 4 a.m., I was admitted to the hospital. At 10 a.m., doctors gave me medication to stop contractions and help my daughter's lungs. So that medication that they gave her to help her daughter's lungs were those 2 shots of steroids that I was talking about. And they also gave her medications to stop contractions, to try to keep her pregnant longer. At 24 and 5 days, that's 3 days later, at 4 a.m., I started with contractions and heavy bleeding at 9:34 a.m. My daughter, Janelle, entered the world weighing 1 pound and 10 ounces and she was 12 inches. So during labor, doctors noticed that I had a blood clot, and I was very lucky that I was still here. Wow. So here's a picture of Janelle when she was first born. So in this picture, she's intubated. She was intubated, meaning she had the breathing tube to breathe for her, and she has all these wires around her. And when they're born this young, 24 weeks, their eyes are still fused. So her eyes are still fused. I can see that. So babies that are born this young, we call them micro preemies. We always put a blanket or like a face cloth on their eyes whenever we turn on the light or do an assessment. But just so you know, her eyes are still fused together. How was your NICU stay? Janelle was born at 24 and 5 days. Our NICU stay was 137 days. So the earlier the baby is born, the longer they stay in the NICU. So babies that are born under 28 weeks tend to stay in the NICU for months. She fought 6 infections, PDA, eye surgery, 5 platelet transfusion, 5 blood transfusion, stage 2 brain bleed, critical lung disease. They told us on June 27th, on July 14th, and July 16th to disconnect her because she was very sick. My husband and I said this wasn't an option. Her oxygen saturations were the lowest at 40 to 70 for weeks. Wow. So she was in every ventilator's machine that you can think of, maxed out for 6 weeks. So whenever a baby is really sick like this, and they are on the highest setting of the breathing machine, and they are on the highest oxygen, and the baby's still not doing well, and heart rates are dropping, then the doctors will consider disconnecting and palliative care. And of course, that's up to the parents, if the parents would like to do that or not. And then out of nowhere, our daughter did a 360. Wow. And I've actually seen that. I've seen that in the NICU of babies that are really sick, and we thought that they were going to be palliative, that they weren't going to come back from what they were going through. And then the next day I come back and breathing machine settings have come down and they're doing better. So it's amazing how babies can heal so fast. And so this is a picture of Janelle now, I believe. Oh, what a cutie. She has nasal prongs, so I don't know if this is at the hospital or at home, but she does have some nasal prongs to give her some oxygen, and she is so chubby. What a chunkster. So cute. And then this is another picture that Erica sent me, and I believe this is when she went home. The baby's in a car seat. Oh, what a cutie. She's so chubby. So chubby. It's all the fortification that we give our premature babies to gain weight. But she has oxygen to help her breathe, so she went home on oxygen. What a cutie. And that must have been like the best day of their life. Having taken your baby home is one of the best days of any NICU parent's life. Because imagine being separated from your baby for months, every day going to the hospital, every day holding your baby, and then having to leave them. And then finally you can take them home and they're with you all day, and it's amazing. I can probably relate to all the feelings that Erica's probably going through. Advice on prematurity and NICU. The NICU is a roller coaster, but it does eventually get better. Micro preemies are tiny but mighty warriors. What I learned from my NICU stay, so micro preemies are babies that are born under 28 weeks. What I learned from my NICU stay is always ask many questions, yes. Learn everything about medications. Write down stuff, since you are the best advocate for your baby on bad and good days. Patience and compassion is key. Trust God and trust doctors and nurses. So thank you so much, Erica, for your story. So basically, Erica had a complicated pregnancy from the beginning. I couldn't imagine how much anxiety and fear she was feeling of probably almost losing her baby on her early stages of pregnancy. But Janelle is a warrior, and she's a fighter, and she's here now. Erica brought up a really good point on you are the best advocate for your baby. Even if you're not a doctor or a nurse, you are a parent. You know your child. You know when something is off. Even if your child is in NICU and your baby's not with you all the time, you're visiting them every day. So you get to know them really well, and they are like a part of you. So even if your baby is in NICU, you still know your baby, and it's still your baby. So if you notice something is off, you will see it and you will feel it. So you are the best advocate. Like, say something, talk to someone, say something and speak up for your baby. I'm not saying doctors and nurses are not doing their job, they are, but I just want to empower parents to advocate and speak up for your baby. If you notice something is off, something is wrong, say something. So that is the end of my stories. Those are my 2 stories that I had for you. So if you're interested in sharing your own NICU stories, check down in the description box and fill out the form. I would love to tell your story here sometime. And I also have a freebie for those parents that are going through NICU right now. So check that freebie down below in the description box. Thank you for listening. I'll see you in my next video. Bye.